right, once again, welcome to the HHIC workshop on person-centered design. I'll introduce our case competition, the Husky Health Innovation Challenge, before handing it off to our workshop leaders. ViTAL is super excited to present the Husky Health Innovation Challenge today, and registration is finally open. This is an undergraduate healthcare case competition that will take place this March. It's an opportunity to work in a team of students from interdisciplinary backgrounds to tackle a problem in healthcare, combining public health, business, design, and tech. All participants will get a hands-on experience in an opportunity that's typically exclusive for MBA students, as well as networking opportunities, and winners will receive cash prizes and swag. This year's case is grounded in a very real problem, informed in thanks to our sponsors, as well as our advisors, mentors, and competition judges. We're lucky to be working with AARP Innovation Labs, Accenture, the Northeastern Bouvet College of Health Sciences, COE, Corey, Johnson & Johnson, and finally the Health Science Entrepreneurs of Venture Incubator at Northeastern. So in terms of timeline, case registration opens today, and between now and when the case is released, we're hosting a couple of workshops with Scout, Case, as well as a panel now as well as after the case competition to learn more about the healthcare innovation journey. The case will then be released on the 13th, and the first week of the competition will be the preliminary round, after which 5 teams will be selected to move on to the second week of the competition, the finalist round, which will culminate in pitch day. And everyone's invited to pitch day to see our teams present, as well as just network with our sponsors and hear from some amazing speakers. So to register today for our case competition, registration just opened, and the first 50 registrants get a lanyard, so I would get yours quickly. Next, today we are excited to present our first workshop, Person-Centered Design in Healthcare. And hopefully this can help answer the question, how do I start designing solutions to a problem in healthcare, keeping the user in mind? And we definitely want students to be thinking about this as they tackle the case, especially because healthcare is so human-centered. To communicate this, we're super happy to welcome Scout Labs and Sarah Constantino to walk us through it. Scout Labs is Northeastern's design studio, and Shannon and Delara on the left are presenting the design process first. Then we'll hand it off to Sarah Constantino, who works at Optum as a design-driven strategist. She's passionate about using empathy and industry-driven frameworks to solve big problems and drive meaningful innovation within the healthcare industry. Finally, we'll finish up with number 3 on an activity that Scout will help guide us through. So with that said, thank you for listening to me, and now off to the workshop. Yay!
And then we're going to pass it off and do an presentation from Sarah, and then we're going to jump into a design thinking activity where we're going to apply what we just talked about, and then we can do some sharing of what we worked on in those breakout rooms, and then also answer any questions. So yeah, like I mentioned, we're from Scout, and a team within Scout is Scout Labs. And Scout Labs is an interdisciplinary team working to create a better Boston through design thinking. So this team is partnered with City Hall, Mayor's Office of New Urban Mechanics, and we have students each semester work on a project in partnership with the Mayor's Office of New Urban Mechanics. And this is a team that is very interdisciplinary. People come onto this team that have no design background prior. We have political science majors, economic majors, design majors. So it's definitely very interdisciplinary and requires no previous design experience. So we're going to just dive into what kind of that process looks that we go through on our labs team.
So hi, everybody. I'm Delara. So I am the director of Scout Labs, which Shannon explained beautifully. What we do follows this human-centered design process, which has several steps, but just a reminder that these steps are not linear by any means. This is simply a way for us to explain this. But without further ado, we can get started on our first step, which is noticing. So the notice phase in particular is the phase where we begin to practice awareness of our personal identities within the project context. So we become aware of our own emotions and biases that can affect this project, both in positive and negative ways. And by acknowledging these emotions and biases, we can better empathize with our users through humility and curiosity. I know these are really big words, but to practice this, we can break it down to 3 steps. So we can identify who we are. So in our past projects, we are obviously students at Northeastern. Our audience was young students in Boston, and our constraints was that we have vastly different backgrounds and experiences from these younger students. So by noticing these differences between us and the users, we can better empathize with them, which takes us to the next step.
Yeah, so taking to the next step, empathize. So the empathize phase is really about learning about who your audience is through observation, interviews, conversations, surveys, and really recognizing who you are designing for and what is important about these people. And kind of, again, always keeping in mind, it's not just you're noticing and then you're just forgetting who you are and going into empathize, but really remembering who you are and the biases you may be taking into these interviews, and really set those aside to really empathize with your users. So the empathize phase is really dedicated to understanding the experiences of those who you're talking to. And again, for this project we're using as an example, we worked with Boston public school students in high schools around Boston. So it was really important for us to talk to students, and this was before COVID, so we were able to go into classrooms and put on workshops and work directly with students and understand their perspectives by talking to them, having conversations, and doing activities. But the empathize phase is really about research and doing different ways of this, so it can look different depending on what your project is. Just some examples, some workshops, surveys, one-on-one interviews, roundtables. It really depends on what you're doing and what your constraints are. But here's an example of how we work through the empathize phase on our project with students.
So the next step is defining. And if anyone has any questions, please feel free to raise your hand with the Zoom function. But defining is where we can better analyze and then synthesize the observations that we gained in the empathize phase. So that can be synthesizing survey responses or reading through notes that we took through interviews. So by doing so, we can identify trends and behaviors that came up in these group data. So through the define phase, we can better define a problem statement. So in relation to this previous project, our problem statement was how might we help BPS students have a meaningful experience with the city of Boston on an action civics project. So that really came out of our workshops with these students, where we found out that they did not feel connected to City Hall. And we thought that a major focus of our work should be to create a more meaningful experience rather than simply connecting them to City Hall.
And then another big part of the design thinking process is creating personas. So these personas are, you could think of personas as fictional characters that you build based on your research. So taking all of that research that you did through the empathize phase and talking to students in this case, or whoever your users are, or those surveys, taking all of that and synthesizing it into personas, because you don't want to design for one specific person. So you want to kind of create these personas that are a little bit more broad and take from a few different people you spoke to or the general audience. And a lot of times you make personas that are a little bit different from each other based on the users you talk to. And when you're making personas, you find that it kind of naturally happens when you start describing this person. It almost becomes this character that you're talking about and you understand them. And it's really good to give them a name and a picture. And on the next slide, you can actually see our 4 personas from this project that were different from each other. They went to different schools, they were different grades, and they just had different attitudes towards the project we were working on. So we definitely talked about these students a lot. And then what comes next is journey mapping. So once you have your personas, you can start journey mapping. And this is a way to visualize the process of a journey. And you could do this through a lot of different ways. Journey maps often look very different depending on your experience or just kind of what you want to portray in these. But a big one that we always like to do on labs is emotion, because it really helps understand the pain points in an experience. So if we go to the next slide, this is an example of the journey map we did for this project. So as you can see, we have kind of our 4 personas and then their experience going to the right. So something like you can just see by looking at this, this was a school project they were working on and the journey they go through with this process. And each student goes to different schools, so they started their project at a different time. So it's a really helpful way to kind of lay out on a piece of paper or on the computer different personas' journeys. And it really helps to uncover opportunities for improvement by depicting opportunities where an experience can be enhanced and really digging at where are the pain points in a user's experience.
So the next step following the define phase is ideate. So through the ideate phase, which our design thinking activity later on we'll touch upon, we try to generate as many solutions as we possibly can. So that doesn't mean that every solution is going to be prototyped. We are just trying our best to get every single idea out there. So this can play out in a variety of ways, but we personally like to do reverse brainstorming, where we ideate the worst possible scenario and then try to come out with a solution the exact opposite of that, which is kind of fun. But from this experience, we can then select the most meaningful solutions and the most tangible solutions, and then move forward to the prototype phase.
Yeah, and just something to note on Ideate, there's a lot of different brainstorming activities and just activities in general to get you thinking, because sometimes you find you've done all this research, you have these personas, you have so much. So it's really great to kind of incorporate different activities to help you synthesize all of your research that you have been doing. And moving to the next one, we have prototyping. So this is when you bring one of your ideas to life and you start actually creating whatever that is. In this case, for the project we worked on, it did end up being a website, so an online platform for students. But something to note is that it didn't look like this when we first did our first prototype. Prototypes definitely take on a lot of iteration and it's experimental. So what you make at first doesn't have to be the final solution. And it's really important to go into this not thinking that you solved your problem statement at this point, but you're just working through an idea and you want to test it. You want to understand if this is the best solution or if you need to go back to the drawing board. And like we mentioned, this is a process that doesn't just go 1, 2, 3, 4, 5. So after this phase, you can easily just go back to research and understand that you completely missed a piece of your process. So you need to go back and add a completely new thing into maybe this website.
And the second to last, usually the last-ish, stage is the testing stage. So we take the prototype and pretty much test it with people. So through testing, we try to get feedback from our users and learn about how we can improve the prototype itself. So through feedback, we can better see things that weren't pointed out to us during research. So in this project in particular, we realized that our language was not particularly accessible to high school students. We were using language that was more accessible to us and City Hall employees. So through the testing phase, they pointed out places that we can make our language clearer or more friendly. So through the testing phase, we were able to go back to the prototyping phase and kind of fix our prototype and bring it back to them later on.
Yeah, and then iterate. That's kind of what Delara was just explaining is kind of once you're testing your prototype, you're oftentimes going to see stuff you didn't see when you were first looking at it. And that perspective from your users, because again, human-centered design and designing for people, you want the feedback from the people because you aren't designing this prototype for yourself. So although that language might be understood by myself. In the testing, I want to really understand what they're looking for and how I can base it on my users. So then I would go back to iterate on language in that case, but this can take many different forms based on user feedback.
And yeah, so that's the human-centered design process in a nutshell. That was a lot to throw at you guys. This is not a process that takes a week. We work on this process. Our teams are semester-based. Our projects are a year-long. So this process takes many, many weeks. So please, if you have any questions, let us know. Oh, so that's a sad slide. But I will pass it off to Sarah, who will be talking about her process.
Awesome. All right. Thank you, everyone. Thank you, Shannon. Thank you, Dora. I really liked the addition of the notice in your design thinking phase. I don't think that's as traditional, maybe. It might be something a little bit more new in that process, but I think it's super important, especially as we think about health equity, right? So what is the lens that we're bringing to the table, maybe from a more privileged background, especially as we're designing for others. And I think that'll be a good lens that I hit on in the example I'll show shortly. But I wanted to just give a little background about myself and the company I'm from. I know folks are in school and always interested in learning about companies that are doing cool things. So my name is Sarah Constantino. I am an associate director of product strategy at Optum. Optum is the technology and health services arm of United Health Group. So when you think about United Health Group, it's really broken into two. It's United Healthcare, which is the benefits, the insurance, which most people likely know, have seen commercials for. And then Optum is the kind of more health services and technology side of the house. Together, they make up the broader UHG. Generally, the mission of the company is to help people live healthier lives and help make the health system work better for everyone. And diving a little bit into Optum, just some of the core competencies: data analytics, embedded technology, customer and consumer experience, as well as clinical expertise. And there's kind of three major businesses within Optum. Optum Insight is that data and analytics arm. Optum Health we are the largest employer of registered nurses in the United States. So just to kind of give you a good example of the size of the company, we have care delivery organizations across the country as well. And then Optum Rx, you can think of as kind of pharmacy services, anything from drug delivery to your home to infusion services, things like that. So full end-to-end spectrum of anything and everything you could think of in healthcare, we probably cover it. I myself am part of a internal enterprise accelerator within the company. So we work with product teams across United Health Group to help them get new products, services, experiences to market faster. I've been in the company about almost 5 years now. I am a Northeastern alum, if that wasn't mentioned. And yeah, the office is over in Fenway. So it was not a very far move for me. And wanted to talk to you today about a case, about a project I did for prenatal health. So again, just thinking about the healthcare lens that we take, and really the process that we underwent to kind of get to that end solution. It should hopefully look very familiar to you, given we just walked through some of the design thinking and human-centered design phases. So first of all, any project, any product offering, anything that we're looking at, it's always super important to understand the problem statement. If you don't come at it from a good problem statement, you're probably going to miss the mark. And I think a lot of that is part of kind of that notice portion of like, what am I seeing around me? What's happening in the market? What's happening for some of these populations that maybe are underserved today? And so, the why essentially behind this project was infant mortality rates are higher in the US than they are in comparable countries. So if you look at this at this kind of graph here. This is from 2017. It's, I don't think, much better. The US has 5.8 deaths per 1,000 live births compared to some Canada, France, UK, Belgium, and other comparable countries. It's almost twice as many. That's a problem in our country, and those rates increase for minorities, and it's an issue. And so how do we take an appropriate approach to start to work at improving those numbers? There's a lot of different ways to do it. And this specific project was focused on a virtual solution. And so what was our team's approach? We spent 4 to 5 weeks to really understand the current state. So that's ethnographic research, which is, again, what was kind of described there when they were in the classroom. We were working with and talking to expectant mothers, former mothers, partners, experts in the space, all about really understanding what's happening in the space. How are these individuals engaging in their health, and what kind of maybe leads to some of those preterm birth rates? We hold a fusion session, which is, obviously coined by our team, but it's a human-centered design session. It's a day and a half. We go through a bunch of different frameworks to get to that end output, and we'll talk about those in a moment. And then post session, we deliver that prototype, right? So, what is something that is clickable, easy to show to somebody to get that feedback loop going and start to progress the product itself. So phase 1 was that ethnographic research, and I kind of hit on it there, but we, worked with a wide group of stakeholders, again, expectant mothers, first-time mothers, prenatal experts. We have a women's health arm, which I would like them to change the name of that, but in the organization, so talking to OBGYNs and individuals in that group, and then ultimately talking to employers, right? We're an insurance company, so a lot of our products go through employer and individual offerings. We also do offerings through things like Medicaid and Medicare. And so trying to get a full spectrum of the stakeholder map, essentially, while also really understanding who it is we're serving at the end of the day, and that is the expectant mom. Phase 2, then, bringing all that research into a fusion session or that human-centered design workshop. We start every workshop with a design statement. Again, the design statement itself is kind of formulating the problem statement. What is it we're here to do? For this session, we're designing a virtual group prenatal solution by leveraging deep research and empathy in order to help women empower themselves to make informed decisions for their health, pregnancy, and lifestyle goals. So that was, hey, we're getting 20 people in a room together. This is what we're here to do for that day and a half, highly focused energy towards creating that solution. And again, as we was called out earlier, just how do we start to focus that energy? Again, it's not about us as the individuals in the room, it's about who we're serving. And those were embodied by personas. So we took the interviews and the research that we did with those expectant moms and created 2 personas. Again, as was described, we wanted to create different personas because they're going to be in different journeys, and we need to create a solution that accounts for both of them. And what ends up happening sometimes is we, bring the high-risk mother in here, and we bring the first-time mother in here. And while they have very different experiences and different backgrounds and sometimes different needs, there are a common set of needs that overlap. And so within the session, it was like, okay, well, what can we do? What are they hiring us to do in this instance? It's helping with pregnancy, health, and wellness. It's helping them figure out what the work and family balance looks like. It's helping them make community connections as they go through this experience of pregnancy, but also as they go through returning to the workforce, because that was identified as a big challenge area during that interview process. So we have our personas, we have their pain points, we know what some of those challenges are, and then we want to dive in a bit deeper into their journeys. So what is their journey? And this is a shortened version. This journey map was 8, 10, 12 feet long because it's 40 weeks plus another 10 to 12 when you get the return to work situation. And so it was pretty crazy in the room, but really walking through week by week. And I learned a ton having, I have no children, about the amount of doctor's appointments that they have to go through. And when you think about it for a woman who is working full-time and maybe is not in a position where she gets the flexibility to get a lot of time off. She works in a call center. She, works as an hourly employee, isn't able to take the time off to go to those doctor's appointments, causes a lot of trouble. Maybe she misses them. And that's how we start to get into some of these challenges around having preterm birth rates even occur in the first place. And so how do we start to support them throughout this journey is really the question. And so another tool we love to use, and I imagine the folks at Scout like to use it too, is, how do we get to the right solutions? It's all about asking the right questions. And so as a team, we established kind of 4 big ideas based on the questions we were asking. And we love to use the term, how might we? Because it allows us to open up our minds and say, should we do this? Could we do this? It's no, how might we do this? It doesn't eliminate anything off the table. It just allows us to expand ideas first and foremost. Sometimes those ideas aren't feasible, but that's okay, because maybe there's a seed of that idea that will work in some other context. And so for us, it was, how do we create awareness about this program? So how might we engage them early? How might we get more information to these mothers sooner? How might we generate engagement? So how might we give and provide reliable information? How might we help individuals prepare for their appointments? At establishing a community, how might we provide resources as they move through these things? And then maintaining connection. So how might we provide support even after that child is born? And so upon asking these right questions, it's really enabling us to get to the right solution. And so within that, it says, okay, now let's bring it all together in that synthesis phase of all of our ideas. What might it look like? And how do we start to prototype a concept that we can go test and validate? And so we in the room, I am not an artist by any means, but we have great designers on my team that love to do live storyboarding. And so it was using a set of design principles, which is another great framework and tool to help kind of create the scope for what the product should be. And so we said, hey, our design principles based on what we've learned is that we need to be focused on the mother's experience, that we need to ensure that we're rooting pregnancy as a life event and not a medical event, as it is usually perceived. Anything we do, of course, we're a big company. We need to be, on the up and up. It needs to be ingrained in evidence-based guidelines. Any guidance we provide should be through a clinician. We want to establish a compassionate and supportive environment. We want to integrate the right technologies to support the program. And we want to make sure that we're ensuring that anything we build is modern, it's flexible, and it's adaptable so that we can quickly change over time as we learn. And so that was essentially how we started to build out that flow. And this is kind of the future state experience with that product. And so, we ended up creating a, baseline prototype here. It's kind of that next iteration from the sketch into screens. And so, hey, these are the different components of the experience that we need to have here: onboarding, personalization, omni-channel, pre-session surveys, group sessions, because it's all about creating essentially a group support group virtually, where there is a trained clinician and then a group of expecting individuals who are there to form that community, but also to get their questions asked. And so this was kind of what the prototype looked like. This was, I think, a week turnaround. So again, not me, it was a good designer on my team. And then finally, what was really awesome about this project is we actually get to see it go to market. So they took the prototype that we did within 6 months. They had created a web-based version of it. So they didn't go mobile first, they actually went web first, launched it with, I believe, 3 to 4 different companies. And have since scaled it. I think they did the initial pilot for 6 months, and then they scaled it even larger after that. So now not only are they serving, I think something like 12 or 13 companies, but they're also offering it through Medicaid in about 15 states. So just really cool to see kind of that process from end to end, and to see that product get into market as well, which is always exciting. Doesn't always happen. So that was a personal win for me, and definitely for the team as well. So I will pause there, and happy to answer any questions if anyone has any, but also want to be sensitive to time. All right, awesome. I'll throw my LinkedIn in the chat as well, but I will hand it back over to the Scout group. Thank you.
Awesome. Thank you, Sarah. I will share my screen to show what we'll be doing. So we're going to go into a few different breakout rooms just to be in different groups for the activity. And I will share my screen to show you what we're about to send. So for those of you who have used things like this, there's Miro, Mural, Envision. There's a lot of different online whiteboarding tools. Since we can't be in person, this is the next best thing. So we've been using these a lot at Scout. They're very helpful for all types of brainstorming. So we'll be using Envision freehand today. And there's just these like post-it notes, and you can just like double click and like type on them for that feeling of putting post-it notes on a page. But what we're going to focus on is kind of the ideation phase. So although we haven't gone through the design process, there is ways to kind of just do activities to get used to it and get an understanding for what it is without going through the whole process. So we're just kind of going to put this hypothetical problem statement that definitely is very relevant to what is going on in the world. And we're going to do a reverse brainstorming activity. So the problem statement, just like Sarah said, we love to use how might we's as well. So the problem statement we're going to be using is how might we make COVID-19 vaccine information more accessible? So using kind of the information you do have and know personally, again, you're not kind of empathizing with your audience because we're doing kind of a rapid activity right now, but we're going to start with reverse brainstorming. So this is kind of, you're just going to like flip the statement. So how might we make COVID-19 vaccine information the least accessible possible? So it sounds kind of crazy to start thinking about, but kind of it is helpful then to flip it afterwards. So you can take about if someone in your group wants to start a timer for 1 minute, you can just kind of rapid brainstorm. If you need a little bit more than a minute, you can on these post-its, the reverse statement. And then what you're going to do is you'll do that silently, and then you could start to group, because I'm sure you'll see that there will be trends within your group. And then after that, you can kind of switch those groups. So if you have a group that says something, you can just kind of switch it back to what the actual answer to the problem statement would be. And then after that, after you have those categories, you'll end up with some answers to this problem statement, some ideas, and then you can start crazy eights where you can decide. You can always like copy and paste if you want more boxes depending on how many people are in your group, but you can just start sketching some ideas for prototyping based on the ideas you come up with in your brainstorm. I know I went through that pretty quickly, so if anyone has any questions, feel free. Does that make sense? Okay, awesome. So we'll send this link first before we send everyone off. Oh no, I lost my tab. There we go. Laura, do you have the link? Oh wait, I have it, sorry.
Oh.
I got it. I'll send it in the chat. And then they're labeled by group, so whichever breakout room, that will just be your group's little area on the page.
Okay, cool. If everybody can open the Envision, I put everybody in breakout rooms. There are groups of 4. One of the groups is a group of 3, but we will be floating around to help you guys out. So please don't worry, someone will probably come in soon. So I will just open the breakout rooms. Just want to make sure the link works for everybody. Yes. Cool. Great. Yay.
Participate. Awesome. But yeah, if you ever have any questions or how to apply this to the work you're doing or anything related, we have some resources at Scout. So I'm going to share my screen again. So the first one is Scout office hours, where we kind of just have an open time on Zoom where anyone could come in and just get feedback from Scout members, talk about basically anything. So definitely, if you're ever interested in learning more about Scout, have a question about a project, interested in learning more about the design thinking process, definitely stop by. We have a Zoom link that's used every week. I'm going to send a Notion page, which just has like all this information and links and everything you need to come to these events. So that's every Monday, 6 to 7, and also every Tuesday, 5 to 6. Then we have bi-weekly speaker series. And actually, we're just about to announce our first one of the semester, which is next week with the director of design at Bumble. So that will be next Thursday, 5:30 to 6:30. If you follow us on like all those platforms, you'll definitely see some really cool collateral designs coming soon. And then our biggest event of the year is going to be April 10th, which is our virtual conference. Usually it takes place in person, but we're going to be putting on our conference, and our team has been working really hard since the summer to put this on. So we're really excited for that coming up. And you could definitely find a lot of information about that on our website. And then of course, we have a newsletter. So in the link I'm about to send, you can get that information too, where we send out newsletters about everything happening at Scout. And then, of course, our social media, we basically put everything. I just said it on our Instagram, and you could always stay up to date on all of these. And always feel free to reach out via email. Thank you so much. There we go.
Awesome. And then circling back to HHIC, hopefully this workshop kind of gave a better idea of how these design concepts can potentially be applied to the type of problem solving that you might do in a case competition. So keep an eye out if you're on our mailing list for workshops on digital health throughout the ages next week, the week after on business concepts in healthcare. And then after the case competition happens, we'll be having another panel on healthcare entrepreneurship from idea to reality, just so you can kind of learn about how you would grow an idea further if there's something from the healthcare case competition that you are really proud of. So yeah, please reach out to us at vitalhhic.org or innovationchallenge@gmail.com if you have any sort of questions, anything like that. And definitely register for our case competition. You can either register as a team of 3 to 4 students or also as an individual, and we'll help match you in a team. So we're super excited to see y'all there. Yeah. And then just finally, as you know, HHIC is a part of ViTAL, Northeastern's Healthcare Innovation Core. So just want to plug next week's event, which is also part of our workshop series. It'll be an hour-long event. We won't go past 7, about digital health throughout the ages. So that'll hopefully get some background, especially on the healthcare side, from some entrepreneurs doing really cool work in this space. And maybe it'll help kind of inspire some of the ideas that you might come up with. So feel free to reach out at any point to ViTAL or the Husky Health Innovation Challenge planning team, and we'd be really happy to chat with you. Thanks for coming.
Thank you.